continuous. Now to look at the blood vessels. This would be the left internal jugular vein returning blood to the heart, and there's the left subclavian vein. Together they would form the left brachiocephalic vein, and arrows are indicating the direction of blood flow to the heart. Blue because they're deoxygenated or low in blood. The right internal jugular vein, right there, along with the right subclavian veins, the subclavian vein. And then those two would coalesce to form this vessel here, the right brachiocephalic vein, once called the Innominate vein, an old term, not really used much anymore. And the arrows show the direction of blood flow of the blood returning to the heart there through the superior vena cava. And here's the pulmonary artery again. And the left pulmonary going out. Again, those blue branches. Here opening up the heart, the right atrium receives blood from the superior and inferior vena cava. Missing here would be the inferior vena cava that the pointer is passing through, if the inferior vena cava was present. Now going down into the right ventricle, the chamber looks small, but on a more lateral view it would be larger. And the white there would be the right AV valve or tricuspid valve, or also called the right atrioventricular valve. And this now would be the pulmonary valve that exits blood from the right ventricle up in there into the pulmonary artery. Left atrium there receives the oxygenated blood from the pulmonary veins, and it sends it down the left AV valve or mitral valve, also called bicuspid valve, down there into the left ventricle. And from here the left ventricle will then eject blood upward, out, and here into the aorta. Very red because of the high level of oxygen content. And then it bifurcates to the right brachiocephalic artery, once called the Innominate artery, a term still used in some textbooks and by some physicians. And then it continues to bifurcate into the right subclavian artery, and the other one here would be the left common carotid artery, or the second branch of the aorta. The brachiocephalic artery was the first branch. The third branch of the aorta is that one there that's barely seen, the subclavian artery.